Hi, I am Arithra Ghosh, a certified diabetes educator, certified renal nutritionist, certified diabetes self-management educator and trainer. Today I will discuss with you a very interesting topic, blood glucose monitoring system. Blood glucose monitoring system. So let's start this interesting topic. Diabetes and monitoring. Sorry for too late. Diabetes and monitoring. First of all, what is A1C means glycated hemoglobin, reliable measure of mean plasma glucose over 3 to 4 months, valuable indicator of treatment effectiveness, measure at least every 3 months when glycemic targets are not being met or treatments adjusted, measure every 6 months if stable at glycemic targets. Then erythropoiesis, factors affecting A1C, erythropoiesis, increased A1C, B12 or Fe deficiency, decreased erythropoiesis, decreased A1C, use of EPO, iron or B12, reticulocytosis, chronic liver disease, altered hemoglobin, increased factors affecting A1C, altered hemoglobin also, variable change in A1C, fetal hemoglobin, hemoglobinopathies, methemoglobin, altered glycation, increased A1C, chronic renal failure or erythrocyte pH, decreased A1C, ASA, vitamin C or E, hemoglobinopathies, erythrocyte pH, erythrocyte destruction, factors affecting A1C, erythrocyte destruction, splenectomy, increased A1C and decreased A1C, hemoglobinopathies, chronic renal failures, splenomegaly, rheumatoid arthritis, HAART meds, ribavirin, dapsone, assays, hyperbilirubinemia, carbamylated hemoglobin, ETOH, chronic opiates, hypertriglyceridemia is a cause of decreased A1C. Okay. SMBG is a tool, not an intervention. Teach patients to monitor with meaning. Monitoring with meaning, SMBG accompanied by structured educational program to facilitate behavior change results in improved outcomes. Teach patients how and when to perform SMBG, how to record the result, meaning of various blood glucose level, how behavior and action affect SMBG results. Okay. Self monitoring of blood glucose, SMBG, recommendation tool for healthcare providers. Regular SMBG is required if the person with diabetes is using basal bolus insulin injection therapy of insulin 24 times per day, using CSH, using insulin 4 times per day, insulin less than insulin using insulin less than 4 times per day, pregnant, hospitalized, or another condition. Increased frequency of SMBG may be required if the persons with diabetes is using drugs known to cause hypoglycemia, sulfonylureas, meg- meglitinides, has an occupation that requires strict avoidance of hypoglycemia, not meeting glycemic targets, newly diagnosed with diabetes, less than 6 months, treated with healthy behavior intervention and non-insulin agents and is meeting glycemic targets. Daily SMBG is not usually required if the person with diabetes treated only with healthy behavior intervention and is meeting glycemic targets has prediabetes. Continuous glucose monitoring CGM measure glucose concentration in intestinal fluid. Two types: real time or personal. Continuously displays blood glucose levels. Blinded or professional captures blood glucose levels that can be downloaded later. Real time CGM has been shown to reduce A1C in adults and children with type 1 diabetes with and without CS2 in adults with type 2 diabetes. Reduce time spent in hypoglycemia. Successful use of CGM is dependent on adherence with duration of time used. আচ্ছা, এবার হলো যে কন্টিনিউয়াস গ্লুকোজ মনিটরিং সিস্টেম সিজিএমএস। কিছু কিছু কোম্পানির নাম হচ্ছে, যেমন হচ্ছে ডেক্সকম 7+, ডেক্সকম G4TM, গার্ডিয়ান রিয়েল টাইম, ফ্রিস্টাইল নেভিগেটর 2, HG1C, গ্লুকোট্র্যাক টিম। ওকে, রিয়েল টাইম কন্টিনিউয়াস গ্লুকোজ মনিটরিং সিস্টেম what is it as insulin pump integrated with real time continuous glucose monitoring that measures the glucose levels for up to 72 hours. How does it work? Diabetic must use Minimade paradigm insulin pump, a device that delivers insulin to the body through though a small plastic catheter. They must also wear a sensor that monitors glucose for up to 3 days, that is connected to the mini link transmitter. The transmitter sends the technology the insulin pumps with real-time alarms diabetics when their glucose levels are high or low. Okay, why is this advanced? Once diabetes of glucose levels, a finger stick night miss helps take action and gain control sooner. The real-time trend graph shows how meals, exercise, insulin and medication affect glucose. Visualization and interpretation of continuous glucose monitoring CGM curve. It is the CGM curve. It is the representative visual report of glycemia observed for a study participant over 6 days of CGM. It is the study curve. CGM AGP. It is the CGM AGP picture. Flash glucose monitoring measures plasma glucose in intestinal fluid. Blood glucose values displayed when sensor is flashed with a reader device on DEMA. Displays plot profile of last 8 hours. Sensor can be worn for 14 days. Has been shown to decrease time spent in hypoglycemia in T1D and T2D. Next হচ্ছে flash glucose monitoring outcome. Then blood glucose monitoring. What is it? Blood glucose monitoring is a way of checking the concentration of glucose in the blood using a glucometer. What is this purpose? Provides quick response to tell if the sugar is high or low, indicating a change in diet, exercise, or insulin. Over time, it reveals individual of blood glucose changes. Next, reduces risk of developing complication with diabetes. Why monitor blood glucose level? Reduces risk of developing complication with diabetes, allows diabetics to see if the insulin and other medications they are taking are working, gives person with diabetes an idea as to how exercise and food affect their blood sugar, may prevent hypoglycemia or hyperglycemia. A1C percentage হচ্ছে individualize on the basis of age, comorbidities, duration of disease, and hypoglycemia risk. In general, less than or equal to 6.5 for most, closer to normal or healthy, less strained for less healthy. Fasting blood glucose mg per dl less than 110. 2-hour ppbg is less than 140. Gestational diabetes mellitus gdm, preprandial glucose less than equal to 95. 1-hour ppg mg per dl less than 140. 2-hour ppbg less than 120. Pre-existing T1D or T2D, pre-meal, bedtime, and overnight glucose 60 to 99. Peak ppg 100 to 129. A1C less than 6%. Impatient glucose targets for non-pregnant adults. Intensive critical care glucose range হচ্ছে 140 to 180. প্রিমিল গ্লুকোজ থাকা উচিত লেস দ্যান 140 অ্যান্ড র্যান্ডম গ্লুকোজ থাকা উচিত লেস দ্যান 180. ওকে, when to check blood glucose levels? When you wake up, before meals, 1 to 2 hours after meal, before physical activity, 15 minutes after physical activity, before bed. Okay, glucometer is an electronic device used to test the amount of glucose in the blood. New models are able to read and calculate the blood sugar within seconds. Some models not only display the glucose reading but also say it. Okay, how a glucometer works? Prick side of finger to get a small amount of blood. Place a blood on the test strip. This strip interfaces with a digital meter, enabling it to read the strip. Within seconds, blood sugar will be displayed in the meter window. Hypoglycemia and mortality. Several large random RCTs, random control trial, found that T2D patients with a history of one or more severe hypoglycemic events have an approximately 2 to 4-fold higher death rate. Severe hypoglycemia may precipitate fatal ventricular arrhythmia through an effect of baroflex sensitivity, or hypoglycemia may be a marker for persons at higher risk of death rather than the proximate cause of death. SMBG or CGM is necessary in all patients taking insulin, with increased frequency of monitoring recommended for patients taking mealtime insulin. Okay, advances in blood glucose monitoring alternate the site testing. Next, continuous glucose monitors, non-invasive, semi-invasive, and surgical laser. Okay, at last, blood glucose meter Glucowatch biographer, Hypomon silicon microneedle, Cell Robotics Lazette, glucose control benefits, few or even no complication, normal lifespan, feel better, stay healthy, have more energy, reduce risk of hyperglycemia and hypoglycemia also. Long term benefits, lower chances of having a high eye, heart and kidney disease and nerve damage, enjoy a better quality of life. What to monitor in diabetes? A1C, EAG, cardiovascular health, blood pressure, weight, cholesterol levels, kidney health, eye health, foot health. Okay. কুইক টিপসের মধ্যে হচ্ছে ওয়াশ ইউর হ্যান্ডস উইথ সোপ অ্যান্ড ওয়াটার, সো জেনারেল থিংস. ওকে. Record chart and materials to distribute, this is the points. This is the points. When to do extra checking, this is the points. Non-invasive glucose monitoring for diabetes, 5 strategies under development. This is the key messages. Okay.